from a product. So what about that, Tom? How pricing kind of plays into all of this, and does it affect how much money actually goes into the research, I guess, is a follow-up to your question.
I think there needs to be a balance. The balance needs to be between having a reasonable price for innovative medicines that change patients' lives and that required a huge investment to develop, and I believe that those innovative medicines deserve a high price. But I also think that once the medicines are no longer innovative, once they've been on the market for decades, then there should be a process that ensures that generics actually are generally accessible to the population. The other half of the bargain, that in future, those medicines become more affordable for people, is also kept. Obviously, a very beneficial effect on performance by physical activity, there's no question. So I would never doubt the fact that there is a constant exchange of information, if you want to call it this, or of, in German the word is Wechselwirkung, since you have a German accent. There's a constant exchange back and forth between all parts of the body, and that includes the immune system as well. That includes, for example, diseases like Alzheimer's disease, where for sure it's not just neurons that go basically kaput, that break down, but it's fundamentally a disease of the body. So I do believe that in brain science we have to consider how the body feeds back onto the brain, and I don't think there's anything magical about this. I think there's physical mechanisms that mediate those processes of being too stringent, because I feel that we need to have drugs that people can trust and not drugs that may or may not work. And so I'm personally not overcritical of the FDA.
So the question is, what is Tom's view on the usefulness of technologies that allow real-time, I guess, observation and imaging? Okay.
Well, it depends on the question, but for example, you could easily imagine that for screening, they're going to be very, very useful. Technology is changing neuroscience very rapidly, and there's many different types of technologies that are new. We live in a completely different era. Most neuroscientists think about things like optogenetics. I'm not sure that that's very useful, but I think what's incredibly useful is cryo-EM, which has changed how we see molecules. It's have a deep impact on biotech. Although, you know, in the end, what's really important is having a good disease model, a good question, something to grab onto. Yeah. It's a requirement now, so it's not a problem anymore. The problem is more ingrained in small trials that are performed by universities and hospitals and that are sometimes not transparently handled. Of course, I mean, you're absolutely right. There has to be absolute transparency. Every clinical trial needs to be registered and needs to be reported. There's no question about it. Otherwise, it's lost.
You know you're talking to somebody who really knows what they're talking about when they're willing to admit that they don't know. So with that, I want to thank you for being here. Really appreciate you coming all the way up here on a rainy day. I want to thank you, our audience. Casey runs a tight ship, so we're going to stay on schedule here, and Tom has to get back down to Stanford. So with that, thank you again, and I'm going to hand this back to you, Casey.
Fantastic. Thank you so much. Now we are going to have three of our sponsors, first starting with the venue host, and then two others. They are going to briefly explain the higher consciousness you will get when you are part of their ecosystem?
Delegations from Asia, Europe, Africa, Central and South America, and beyond. And really, that's what's setting us apart. We're creating a diversity-centric, inclusive community that's not just about startups and investors. This is really about the community of San Francisco. So we also do a lot with music, arts, fashion, and sort of bringing in some of the less common verticals in the startup ecosystem. We're also really trying to build a bridge to unique ecosystems globally as a way to connect startups and help boost their growth, connect them with like-minded investors.
And affordable, and there's no coagulation, there's no bleeding. It's changing the way these surgeons are doing medicine right now. We targeted 3 different areas. The one area right now where we targeted was benign prostate hyperplasia, which is just a growth in the prostate, which happens to all men. If you live long enough, you will have this condition. So 60% of men over the age of 60 have it, 70% over 70. It's not cancer, it's just something that has to be treated. In terms of female incontinence, we've developed a laser that we can treat you in 5 minutes, no anesthetic. So here we're solving a problem right there. And in bladder and kidney stones, we've developed a new laser. All of these have single-use fiber optics. And this laser we can treat in the upper kidney, a kidney stone, without having any incisions in the body. So we're making dynamic shifts in how we treat medicine, saving money, and making people's lives a lot better. Okay, thank you.
That we have here as a community. So for this event that Casey is doing with Pitch Global, I really think this is a unique opportunity to talk to one another, to exchange ideas, and to help one another. I think that's kind of the basic, that's our strengths that we should always keep in mind.
Versus M&A acquisition by big medical companies. So if we start with IPOs, IPOs cannot be considered actually as exit strategy. IPO is not an exit event. IPO is the financing event. And companies go public to raise money for the activities, for the clinical programs.
They said, forget every single term sheet that was in the play, every single investment round that was in the play. This is what we want. You give 50% of the acquisition capital to the employees, otherwise we don't acquire you. End of discussion. You either accept the terms or not. So all the 2x, 3x, you had a choice. And I told actually all the investors, I was on the board of directors, you have a choice. You either put $120 million into the company to further the development of what they're doing, or you sell to Intel and you will have a 1.1x.
Devices. So I know the creator of LiveStraw, right? So if you buy LiveStraw from the US, it costs you a lot more than what he's selling in Africa. So, I mean, that's another differentiating factor that you can do is, depending on the address of the buyer, have a price differential.
Like $30 billion a year. And there are private foundations, there are grants at the university, so you can go to so many sources to finance a project like that. And I think that's the right thing to do, because you cannot go to private investors with an idea, because you at least need to have a proof of concept.
What they're investing, what stage they invest in, and get clarification before you're going and doing pitches and spending time prepping and going all over the valley to meet with people. For us, we're usually closer to either commercialization stage or approaching into phase 1 trials before we're really getting excited about a device or a drug or what have you. So understanding that, so you're not wasting time and resources.
And so if you're doing anything with, you know, life sciences or FDA approval, you're more of a stepwise function, so the rule doesn't quite apply to you. The way I would think about it is laying out a plan of what metrics do you need to hit to get the next round. And so I've sort of tried to, I know this problem, so I've tried to solve it for my portfolio companies, and the way of solving it is I'm stepping in as their free CFO. I'm actually telling them, from what I know from my VC network, this is what they're looking for to raise your next round. You got to hit these for me to get you money for the next round, right? And so then that's how we plan out, this is how much you need this round to get to your next metrics.
You can get access to the scientists, was the argument. You can get access to the lab space. And they have a first right to basically take the company out when the milestones are hit. What is today's vision to this?
It depends.
Well, it depends. I would say you need to be careful with that. And every time it's a business decision, sometimes it makes sense. But most of the time I find it really tricky because it limits your exits, as you correctly mentioned, and it exposes you. It exposes your IP, and you kind of merit to one company, which is not always optimal, because you can get access, if you have money, if you have venture money, you can get access to the lab space, you can get access to the talent. You don't really need that big guy.
Fantastic drug, fantastic device. It's got great potential, but if the deal isn't good, then it's something we really pulls us back.
Funded. So I still don't fully understand the question, but certainly you have a lot of flexibility if you're a multiple product company.
Talking to startup lawyers, they say that what's most important is what's not on the term sheet. And I'd like you to talk about what's not on the term sheet and what you feel is the most important things that are not on the term sheet.
Gwen, I think you know the gaps in the knowledge. So you answer it and we have to end this part.
I usually put a lot of things in the term sheet because so I'm actually not the best person to okay, so the reason why you have a term sheet, the reason why you have contracts is when things go to hell, right? And so that's why you spell everything out. Does that make sense? So if your company is growing faster than you expected, nobody's going to be bitching.
Okay, we have run out of time. Ask Roger. Roger will give you the answer after this.